A 25-year-old man comes to the emergency department complaining of severe pain in his right wrist. The pain started after having a fall on his outstretched hand. Physical examination reveals tenderness and swelling in his right wrist. He is unable to extend and abduct his right hand at the wrist. Which of the following muscle is affected in this patient? So abduction of his right hand and extension at the wrist, it is because of which muscle? We have to find it. First option is extensor digitorum. Extensor digitorum it helps in extending the medial 4 digits. It can also extend the wrist. That is the work of the extensor digitorum. It comes from common tendon from lateral epicondyle and gives rise to 4 tendons for the medial 4 digits, and it is inevitably posterior introssetional. Second option is extensor carpi radialis longus, which is a superficial muscle. It is originated from lower 1/3 of the lateral supracondylar ridge of the humerus and inserted into lateral side of the dorsal surface of the base of second metacarpal bone. Extensor carpi radialis longus, it is pierced when radial nerve, and it acts with extensor carpi ulnaris which helps in extending the wrist. Acts with flexor carpi radialis, abducts the wrist. Okay, with flexor carpi radialis, it abducts the wrist. Okay, with extensor carpi ulnaris, it extends the wrist. So extension and abduction is done by flexor extensor carpi radialis longus. Okay, this extensor carpi ulnaris is nothing but a superficial muscle. Okay, by the common tendon from the lateral epicondyle only. It is inserted onto the medial side of the dorsal surface of the base of the fifth metacarpal bone. It acts as the extensor carpi radialis to extend the wrist, acts with flexor carpi ulnaris to adduct the wrist. So adduction, it is done by flexor carpi ulnaris, and flexor carpi radialis, it abducts the wrist. Flexor carpi radialis. Extensor carpi radialis longus, it acts with flexor carpi radialis to abduct the wrist. Next, about brachyradialis. Brachyradialis is the third option. Brachyradialis, it comes from upper 2/3 of the lateral supracondylar ridge of the humerus. It is inserted into lateral surface of the distal end of the radius. Distal end of the radius just above the styloid process. Nerve supplies radial nerve, flexes elbow joint. So flexion of elbow joint, it is because of brachyradialis. Pronate the supinated forearm to mid-prone position. Supinates the pronated forearm to mid-prone position. Flexion of the elbow joint and pronating the supinated forearm to mid-prone and supinating the pronated forearm to mid-prone. It is done by brachyradialis. It is from upper 2/3 of the lateral supracondylar ridge of the humerus and getting inserted into lateral surface of the distal end of the radius just above the styloid process. It is supplied by radial nerve. So according to the question here, extensor carpi radialis longus is answer because it is helping in extension and abduction of the wrist. Extension with extensor carpi extension with flexor carpi, extension with extensor carpi ulnaris, and abduction with flexor carpi radialis. Okay.